I'm Dr. Bill Burman, Director of Public Health at Denver Health. The overall COVID situation in Denver continues to improve. The decrease in case rate is slow, but it's occurring. The thing I look at closely is the percent of tests that are positive. So that metric, percent positivity, remains low at 2.1%. So anything below 5 we think is good, below 3% is excellent. So that's very good to see. And we continue to make real progress with vaccinations. So we're now over 130,000 people in the city and county who've had their first dose, and it continues to increase and starting to approach the numbers that we need to achieve vaccination across the entire community. Yeah, to use a sports analogy, I classify all three of these vaccines as home runs. Home runs in that, well, I can tell you the FDA close to a year ago defined any vaccine which was more than 50% protective as meeting their criteria for effectiveness. And all of these vaccines go way beyond that. And then in terms of safety, the initial trials were large, which let us get a very good look at safety. And now that the vaccines, at least the first two vaccines, have been out for, I guess it's 4 months now, we're getting a much bigger look at safety. And the great news is no surprises. Sometimes people call them the symptoms of reaction. In a sense, they're not side effects. They're the reaction that we expect as your immune system responds to these vaccines. But the symptoms of reaction have been very much as have been found in the randomized trials, and the risks of serious events have remained very low. So really, I think quite reassuring now that these vaccines have been done in millions of people instead of tens of thousands of people, which was the case during their clinical trials. Yeah, I think the new CDC guidance for people who've been vaccinated is a helpful step. The CDC itself emphasized this is one step along the way. It's an initial set of recommendations that surely will be revised on a number of occasions as more people are vaccinated, as we understand more about vaccines and their impact on asymptomatic carriage and hence the risk of transmission. So I think it was a very appropriate initial step and no more than that. I think the focus on having small groups of people who are fully vaccinated be able to socialize together indoors without masks was appropriate. I think we're all thinking through how to apply those concepts in a very different realm, that is in the setting of business, of the activities of a large organization like Denver Health, like Denver Public Schools. And so these don't directly address that, and I think that's appropriate. I think we all need to do this slowly, cautiously, and the start with a focus on family gatherings, small gatherings of fully vaccinated people is very appropriate. Yeah, first, just to make it very clear, the priority of in-person learning. I think there's nothing more important as a community that we can do, is assure that children who want it, have the opportunity for in-person learning. So first, absolutely top priority. And second, in the era of vaccination, it is still absolutely important to use the DPS 5. So universal masking remains critical, distancing to the extent that's possible, early evaluation of symptoms, hand hygiene, attention to ventilation, all those remain critical aspects of keeping in-person learning going for Denver. We still have a minority of the population been vaccinated, therefore, and there's still plenty of people at risk. And rising case rates don't directly impact the schools, but they impact schools inevitably. And so keeping overall community transmission low just makes it that much easier to assure that we can achieve in-person learning.